want to express my great pride and appreciation for the work that our teams did here at both Children's Hospital and OU Medical Center, as well as some patients that were seen at OU Medical Center Edmond. I never doubted that they wouldn't rise to the occasion, but they certainly did that and more. Closest to me is Dr. Roxie Albrecht. She's our medical director of adult trauma. Next to Roxie is Bob Letton. He is our medical director of pediatric trauma at the Children's Hospital. And then Kris Wallace is at the end, our chief operating officer at OU Medical Center. I'll let each of them spell their names. I should have spelled my name to start. Scott, I forgot. Chuck Spicer, C-H-U-C-K, Spicer, S-P-I-C-E-R. Again, appreciate you being here, but again, our thoughts really are around the families and victims of the events yesterday and on Sunday afternoon. Roxie. Or Kris, actually.
Good morning. My name is Kris Wallace, K-R-I-S-W-A-L-L-A-C-E, Chief Operating Officer, OU Medical Center. First, I'd like to repeat what Chuck said and just send out all of our well wishes and our thoughts and our prayers to all of the community members and citizens who have been affected by this, who are out continuing to try to help and assist in the situation. And then secondarily to all of our staff and physicians and residents and every single person that was willing to just be tremendous yesterday in responding to this situation for Oklahoma. Thirdly, I'd like to send a thank you out to the larger community in our nation, because yesterday we received a tremendous amount of phone calls from physicians, hospital leaders, staff, community members from around the nation being willing to give us support or help in whatever way we can. At this point in time, we're keeping a list of those and very, very appreciative of it, but think we have it under control at this point in time. So yesterday, do want to give credit to the fact that we set up both triage systems at both the Children's Hospital and OU Medical Center. Our partnership with Merck and IMSA, as well as the air transport systems, worked very effectively in delivering us patients in a timely manner from the site, allowing us to provide quick and accurate care, which Dr. Albrecht and Dr. Letton are going to further describe. And we had a tremendous response within the hospital of making sure that we had the resources, the supplies, and the personnel to be able to provide the care for what our community needed. And we continue at this point in time with more weather along the way to try and make sure that we are set up to be able to continue to provide that care for the state of Oklahoma. So with that, I'm going to turn it over to Roxie and to Bob to describe the patients and the situations at both facilities.
I'm Roxie Albrecht, Trauma Medical Director at OU Medical Center. Roxie Albrecht. I want to echo what Kris and Chuck have said. My heartfelt appreciation goes out there to everyone who helped in this disaster, and my condolences to people who lost their loved ones in this, and to those who make Oklahoma proud, who make me proud to be an Oklahoman now, that stepped up and helped their communities, from those people who were first responders to the citizens of Oklahoma who were out there in the field doing whatever they could for injured individuals as well as people who weren't injured. We saw a number of patients at OU Medical Center, both at the adult and pediatric side, and I want to really congratulate the pediatric side for doing the yeoman's work. They saw an extraordinary amount of patients in a very short period of time, and what I could see and hear from everybody provided very seamless care to those younger injured patients. We saw 25 adult patients at the Adult Trauma Center at OU Medical Center. The injuries were from minor cuts, bruises, and people who were wet and hypothermic, cold, 2 major severe injuries, what we called the gloving injuries, which is the separation of tissue from other tissues, open wounds, impalements, fractures, open fractures, broken extremities. And I'll tell you, we had, I want to thank every single department at OU Medical Center for stepping up and doing such a tremendous job, from the medical staff to the nursing staff to everybody who supports trauma, and that's the entire hospital, even down to the house cleaning department, and I shouldn't say down to them, I should say they were invaluable to us to help support us in our efforts in taking care of patients. I think that's it for me, and we'll do questions. Bob.
Good morning, I'm Bob, B-O-B, Letton, L-E-T-T-O-N, the Pediatric Trauma Medical Director. I guess the good news is that when I walked in this morning, the number was 51, and I was just told that that number has been dropped down to 24 deaths in the tornado, 9 of which were children, 9 of which we wish we had seen last night. To understand the magic of what happened at the Children's Hospital last night, you kind of have to understand how things operate during normal periods around here. During normal periods, we have what's sort of the standard trauma center, which is actually at OU Medical Center, where Dr. Albrecht hangs out next up on Lincoln. Every once in a while, a trauma trickles into the ER at the Children's Hospital. We decided yesterday that separating and getting all the pediatric services at children and all the adult services on at OU Medical Center was the way to go. So a facility that's used to seeing 1 or 2 traumas a day all of a sudden had over 50. And Dr. Bogey, who's the head of the emergency department, my partner, Dr. Manter, myself, operated a team of people who comprised neonatologists, pulmonologists, gastroenterologists, cardiologists. Every physician in the hospital was down there. Every resident in the hospital was down there. Our pediatricians in the pediatric clinic on the 6th floor stayed, and we opened up sort of a triage area up there so that the walking sort of wounded that came in that just had some wounds that needed to be washed out, or some lacerations closed, or whatever that can overwhelm an emergency department under a situation like this and not let us get the sick people in. They took all those kids upstairs, and they took care of those children upstairs. We took then we were able to focus on the most seriously injured of the patients. There was a total of 50 that came through the door. Fortunately, only 10 of those needed to be admitted. 2 of those actually had to go to the OR last night, and those 2 are in the ICU this morning, but everybody is doing okay today. So for the wave of patients that we had in a facility that just came together amazingly, Dr. Manter and I were able to sit back and sort of help direct traffic and make sure that we were getting the sickest people where they needed to go while everybody else was taking care of the dirty work. It was truly something to watch, especially in a place that's not doing it every day. So my hat's off to the Children's Hospital, and my condolences to the families of those who we couldn't help.
We'll open up for questions in just a moment. I wanted to go over some numbers just so everyone had those at the end. We had just, I think, 94 total patients seen. If I got the number right now, 51 of those are children, and the balance of that would be the adults, so that's 43. 35 yesterday and 8 the day before. So a total of just over 90 patients seen. And we went over the admissions, I think 10 admissions at both OU Medical Center and 10 admissions at Children's Hospital. So 20 of those patients were admitted to the facilities. and Scott's double checking my numbers, but the number kind of bounces around. And the reason it bounces around because it's important to know we didn't close. We kept seeing patients in our emergency departments for all sorts of other ailments and issues and illnesses through this entire disaster. So just as we might have a trauma come in from more, we had an appendectomy come in that needed to be taken care of, or a chest pain in the adult hospital. So it's hard to tease out exactly the numbers that were due to the trauma of the storm versus those that are just a normal course of duty and service. But we were open for all business, and we did not ever cease seeing patients for just the normal routine care that they were seeking. And I also want to mention one final thing, and Kris is going to add a note. We do have a number of our own employees and colleagues that have been affected by this tragedy. And my commitment as the CEO and president of the 3 hospitals is to make sure we provide the appropriate and more than appropriate, the necessary support and care and services for those families that have been impacted. Unfortunately, that number continues to grow. Unlike Dr. Letton's number, which is thankfully going down, we find out just about every half hour or so additional families that are part of OU Medicine and OU Medical System that have been impacted by this terrible event. So it is our duty to make sure we provide them support and care where we can. We're fortunate to have a charitable partner through the Hope Fund, which is a HCA charity. Hospital is a joint venture between the state of Oklahoma and HCA has a charity that they've set up for these events, unfortunately, called the Hope Fund, that we'll use and tap into for support. It's interesting that the Hope Fund was actually started after Hurricane Katrina for the HCA facilities that were in Louisiana. And now we can, unfortunately, draw on that support that our own employees have given to that fund, and now will benefit people that are here in Oklahoma. So Kris had one more addition on the trauma side, and then we'll open it up for questions for any of the 4 of us.
So I did just want to make a comment about the fact that as a level 1 facility in our community, on each and every day we get to provide that care to various different people. But on days like yesterday, that is really what we prepare for, and we hope we never have to provide that kind of care for the community, but work diligently to be able to do that on a daily basis and make sure that we all understand what that means. Because I think both Dr. Letton and Dr. Albrecht alluded to the resources that were available, but there were specialty surgeons and physicians and other care providers at Children's Hospital as well as OU Medical Center. We had the ability to staff and take care of orthopedic trauma, 4 general trauma patient rooms in the OR, every other sort of specialty service that you can imagine at that point in time. And that's really important when you don't know what is going to be coming in through the door. So really, it was an incredible privilege yesterday to be able to provide that service for the community. The only disappointing thing at the end of the day, I think, for all of us was that it didn't continue on through the night, as we had to face the fact that there were some loss of lives in our community, whereas we wished we could continue to care for those people. So with that, I thank you for being here, and I'll turn it over to Chuck for questions and answers.
Any questions? Yes. I think Bob and Roxie or Kris would know the answer to that. I think there were just a few that were on the critical side of those that were admitted. I think we had 2 at both sides that were critical or
Too critical on our side and the rest.
I think we have to not forget about the tornado the night before.
right.
And those individuals, and my heart goes out to those families and those individuals who lost their property also.
Yep. And as you watch our numbers did include the numbers from both storms.
And in that, I'm just kind of going through my head how many we have that are critical, and at least 6 were critical from both tornadoes, and some more severely injured from the night before, from the I-40 incident, than were from the Moore tornado. But we still have critical patients from that. And then serious is probably another 4 or 5 serious patients.
I think the good news is the vast majority of the patients went home, which is what we like to see.
On the adult side, 2 criticals from yesterday's storm. Yes.
From yesterday's storm? Right. Total of 20 hospitalized currently. Yeah, they admitted, right. They're all still in the house. 10 on each, 10 at Children's and 10 at OUMC. I think the number seen was 8 from Sunday storm. We'll break out the admissions from Sunday. Not sure how many of those were admitted. You said there were a number of those that were from I-40, but we'll break out that number, and Scott will have that after the conference. Yes?
It's called degloving, where you have a tear in the skin, and then it, for lack of better description, it peels back. So it's like a glove, but it degloves. As you take off your glove, it opens up. So it tears the soft tissue, the muscle, down to supporting structures. So we've had 2 patients with that type of degloving injuries and a number of patients with impalements of different types of metal, wood, pieces of loose debris that were flying through the air. And then as far as the critical patients, we've had some with spine injuries, spinal cord injuries. Really, this storm was unique from some of the other storms. We didn't see as many head injuries, traumatic brain injuries, as we'd seen from I was here for the second tornado that went through Moore, not the 99 storm. But from other tornadoes that we've had since I've come here in 2001, we had more patients with traumatic brain injuries than this storm, and I can't explain why the mechanism was different in this case. Oh, I can tell you, in our trauma area, we probably had at least 20 anesthesiologists, maybe 10 orthopedic surgeons. We had all the trauma surgeons down there, of which is 5 of us, and several other surgeons from the community that help us with trauma here. There are 2 tinker or military surgeons who rotate down at the trauma center to gain the experience of caring for injured patients. They were there. Subspecialty surgeons who have general surgery background, which most of these injuries could be cared for by general surgeons and orthopedic surgeons, kept streaming through asking what they could do. We had numerous residents from all those services down there, probably another 20 or so of them. Nurses, social workers, case managers, chaplains, administrators. Kris, I turned around anytime I would think of something that we didn't have, and we had everything that we wanted. We had ultrasound machines to do initial evaluations of them. We had every CAT scanner that we have at OU Medical Center up and running, so we usually run 2 CAT scanners. We could run 4 to expedite these patients' care, so that takes another number of technicians, the x-ray technicians. So there's hundreds of people down there.
Was there some sort of call that went out, like an all hands on deck?
Yeah, as soon as the code black went out, we all knew that there was a problem. That's code black was when the tornado warning started and the sirens were going off. We all helped patients move away from the windows, out of the rooms that we could, into the hallways. Nurses, physicians, all the ancillary departments were helping with that. And then the code yellow went off, and that's high alert for us, and I'll let Kris talk about that.
Yes, so Dr. Albrecht is right. We started out with the code black related to the tornado warning. And then as we knew that as we got notice from Merck that there were going to be patients arriving, we went on a code yellow, which for us means that it's an alert to everybody that we have that kind of patient population potentially coming in. And so all of our staff stay. So When you talk about how many people were here, hundreds and hundreds of people were here till around midnight, making sure that we had taken care of those patients. And then about between 10 p.m. and midnight, we started releasing some of the staff. Of course, some of them actually wouldn't leave because they just wanted to stay and help out. So that is the time that we opened up our incident command center as well. And so we had some other of our senior leadership in an incident command center that we could always call to be able to get whatever we needed for those of us that were out in the care settings.
There were a number of, at least on our side, I'm sure on Roxie's side, there were a number of people who weren't on call for the different subspecialties who texted me or called me or whatever and said, do you need us? And they were in as soon as the weather cleared and they could get back to the hospital.
We had nurses, ancillary departmental help that lived north, and they knew that the people that lived south couldn't get to the hospital because of the debris trail, and people who weren't supposed to work last night came into work to see if they needed their support, both on the physician side, nursing side, and all the other department sides. It was an impressive amount of people who really wanted to help and cared.
One other, we're dancing around the microphone. One other group we should note, outside the emergency department, the trauma center, up on the patient floors in the inpatient units, we had medicine specialists, internal medicine doctors that were working and rallying to make sure we could get patients out of the facilities, transferred to other facilities if necessary to free up space. So it's important not to forget those groups that were really staying later and doing a little bit more longer than they normally do just to make sure we had enough capacity of inpatient beds.
That specifically feeds to our system relationship with OU Medical Center Edmond, because I do want to thank that facility and their leadership, both from Dr. Pruitt, the hospitalist, and Lisa Wilson, the CEO. They were willing to take those patients that our medicine teams identified so that we could create additional capacity for the trauma here, and that created a nice flow of opportunity for us.
On my side, nobody's, yes.
My side, everybody survived.
Yeah.
There's been
No fatalities
No
at the
fatalities.
end of the hospital.
Was there any that you guys were worried about? Because obviously, when they came in, maybe you can talk to me about that, a little bit about what the trauma center was like, how you evaluated, who was the recruiters,
I was-
that they had, like a specific patient.
There's one specific patient that's the sickest, but I can't go into too much detail. But I would echo sort of what Roxie said. I was here finishing my fellowship in '99, and I had a vision of a whole lot more head injuries and very severe traumatic brain injuries coming in, because in '99, that's what it was. It was mostly even penetrating head. I mean, we had a stick in the head. There was all kinds of stuff. And then there was a lot of kids who were down in a puddle and literally drowned, in an inch of water. So we had a lot of ventilator dependent patients in '99 that we didn't see in this wave. It was, again, there was a lot of penetrating extremity injuries. There was a lot of degloving or traumatic just sort of injuries to the extremities, fractures and things like that.
Do you know how any of those patients got their injuries? Were they tracked? I know you heard stories
We-
of people. Can you talk to me about that? How they sustained their injuries? If they were.
I think my most severe one that came, not mine personally, but our most severe patient last night had to be sort of crushed, trapped by some sort of heavy, sharp object to sustain the injuries he got. Fortunately, it was all sort of below the waist. So his head was okay, and his heart and his lungs and his kidneys and all, So again, the intensity of this disaster compared to '99 was more sheer volume than it was actual intensity of the illness of the patients. And so it was more of a sheer volume thing. And the other kudos I'd like to give Dr. Albrecht, because she was responsible for part of this, is in '99, there was no trauma system in this state. And people were just going willy-nilly to different places that nobody knew whether they could take care of. And we received kids far later in transfer, like the next day, who should have come to see us sooner. And this time, out there. It happened amazing. It was seamless. As seamless as it could be, considering I-35 was closed at the theater. We couldn't get choppers in the air for a while because there's supercells everywhere. And so what the pre-hospital people did and the trauma system that's been in place since 2000 really all came together and had the significant impact on the number that we're seeing. I don't know where that final number is going to be, but if it had been 99, it would be higher. Just, I have no idea where they could be. I mean, we just get a kid who was crushed, and we have no idea where. So.
Tulsa has a state level 1, American College of Surgeons level 2 trauma center, and they have another level 1 trauma center so they have 2 state level 1 trauma centers, 1 American College of Surgeons level 2 trauma centers. We are the only American College of Surgeons verified level 1 trauma center for both adults and pediatrics in the state of Oklahoma. And have been since 2001, right before I came here, is when we received that designation. And I want to echo the job that Dave Tuggle, Russell Postier, John Sacra, the governor at the time, who saw the vision that we needed a trauma system in the state of Oklahoma after the 99 tornado, after the bombing, and put this together over the past 10, 15 years. This incident proved that all that hard work and planning was worth it, I think, is a better way to say it. Patients got to the right place that I could see. We received what we should receive as a level 1 trauma center. We received a lot of people who had potentially major multi-system injuries, and that's what we live for, that's what we do well, and that's what we want to provide for the community. I think the other hospitals probably, I don't know the numbers that they received, but they stepped up to take their share of trauma patients also. But we want to get, as the American College of Surgeons says, the right patient to the right facility in the right amount of time, and especially those young patients, getting them to a pediatric trauma center where the outcomes are better than other facilities can offer.
And we have actually also reached out this morning to the other facilities. So if any of those patients did end up needing to come here for that specialty care, that we are open and willing and wanting to take those patients and appreciate the care that was given right up front.
I just have one final comment about the question.
We do, actually. That was part of when we went to the Code Yellow, one of the things that we set up. So at this point in time, we have the VOS Auditorium, which is at OU Medical Center. It's on the east entrance. It's a large area. It's being staffed by our chaplain services. And that is an area where we are directing visitors and family members. So if they're looking for someone or needing updates, the chaplains can help them find that information.
I think the one thing I've learned is our need to be there for others when this happens in other locations and communities. As Kris said, we've had calls from all over the country. I personally have had calls from Georgia, Tennessee, Colorado, Idaho, California, Texas, Louisiana, literally across the country. 2 different children's hospitals, Children's Healthcare of Atlanta and Texas Children's, both called offering to send staff. Which is not for us to send them patients, but they wanted to come help us out, which is I think a grand gesture. But it's a note to all of us as we see things happen to be responsive in that regard and proactive and help out when it's our turn.
They are still here. There was one that potentially could have been discharged yesterday. However, with what was going on in the community, we kept that person for another day. Yeah, we received 4, and those 4 are still here. Yeah,
I don't think we received any from the shot from Sunday.
from Shawnee. And most of ours, I think, were from the I-40 incident.
Scott's available for any follow-up questions or conversations individually with our doctors or with Kris. Thank you very much.
This doctor's got me ill.